Welcome back to Long Covid Doctor, an educational series for those of you who still have long COVID. I'm Dr. Tim Robinson, formerly a family doctor, a GP for 30 years, now working in Long Covid Services for 5 years. I post on all the usual podcast channels as well as on YouTube. If you find those posts helpful, do click subscribe. Let's spread the word. Let's share them with anyone that you know who has long COVID. So, thanks for all the feedback you send in, or comments and suggestions. Apologies, I just haven't got time to reply to all those comments and queries. I wish I did have that time. I read them all, though, I appreciate them. And, please keep them coming because I actually find them really helpful for my future postings. So, the other apology, and that is my usual apology, and that is the disclaimer. It's important. Any advice or treatment that I mention should only be considered after you've discussed it with your own doctor, your own family practitioner. So, this talk is all about depression in long COVID. It is an update on the previous posting I did on depression in long COVID. So I will cover the symptoms and the causes of depression in long COVID and the strategies and treatments that can help with that problem. So here we go, depression in long COVID. So, what is depression? Let's just go back to fundamentals here, back to basics. Basically, it is a state of being sort of sad and flat and down with no interest in things you usually were actually interested in or enjoyed. So it affects your thoughts, your behavior, and basically, the sense of well-being. Depression may lead to feelings of total helplessness or hopelessness, despair, even thoughts of self-harm or suicide. Obviously, very concerning. Other symptoms of depression, there's the tearfulness, there's irritability, there's intolerance of others, there's low self-esteem, slow thinking, slow thought processes, difficulty in making decisions. Other symptoms of depression, wanting to be alone, away from family and friends, preferring isolation. There's that disregard of personal care, hygiene, what you look like, your sort of clothing, your dress, just general appearance. There's a lack of motivation. There's just no interest in those things, like I said before, that, usually previously gave you joy, your hobbies, your interests, just not interested. So basically, it's no enjoyment of life as you knew it. There are also physical symptoms of depression in a way. Those, what I've just sort of listed, are the mental effects of the symptoms of depression. There are physical effects of depression, and that is sort of lack of energy, lack of appetite. You've lost your appetite. There's sleep disturbance, either difficulty getting sleep, insomnia, or problems with staying asleep, so interrupted sleep, or what we call early morning awakening. Depression, not uncommonly, can occur alongside of anxiety, or anxiety can sometimes lead on into depression. So anxiety, what's anxiety? Basically that feeling of unease, fears and worries when you feel threatened, either physically or mentally. So there may be symptoms of restlessness, poor concentration, sort of irritability again, and tension, feeling on edge. Then there are physical symptoms of anxiety, then you might have a very fine tremor. You might feel your heart beating in your chest, palpitations. You may have a dry mouth. You may sort of have tension headaches. So, what's the time course with depression? Usually, basically, it creeps up on you without you really realizing it. So basically, people just struggle on with those symptoms, mainly mental, but also those physical symptoms. They struggle on with them for weeks or months, just trying to cope with those symptoms, trying to overcome them. So basically, they are usually, someone who's got depression is usually quite unaware that they have become unwell, that they have slipped into that depressive state. Often it's more a friend or a family member who has noticed that change and suggests to you that actually something's not right. What's wrong with you? Those sort of comments. You're not your normal self. You've lost your glow. You've lost your mojo. So what's it all about? So those are the sort of symptoms, and both mental and physical, that would make someone suspect that they have depression, or make your loved ones or partner or friend suspect that things aren't right, and you might have a touch of depression, as they say. So, question: why does depression come about in long COVID? What are the causes of depression in long COVID? Well, very reasonable question. There's often the assumption that it's just because of the impact that long COVID is having on your life. The effect that it has brought about, namely, your loss of self-confidence, your loss of self-belief and self-worth, the effects that long COVID is then having on yourself, but also your family, and maybe your work. Maybe you're not being able to work, and so consequently the effects on your finances. Then it's the effect of, maybe it's the fact that, you do not see any improvement. You just feel fixed in your long COVID. It's not getting better. Maybe it's because, actually you don't see that there are actual treatments that are proving to be actually effective at reversing your long COVID or the depression that you have. So people, and often people, those around you or your employer or other family members think, that depression in long COVID is only due to those feelings of loss of self-worth and loss of confidence and the effect that the long COVID is having on you. But actually, there are also physical causes for depression in long COVID. So basically, it's the effect of long COVID on the brain and the nervous system. So remember, long COVID, the causes for long COVID are due to that inflammation and that dysfunctional immune system and mast cell activation and dysautonomia that disrupt the whole body harmony and balance and disrupt the connection between all the systems in the body. The immune system, the anti-inflammatory system, the autonomic nervous system, the hormonal systems. All these lead to disharmony and imbalance, and specifically in the brain. And this causes an imbalance. This imbalance causes an imbalance of chemicals in the brain. So those neurotransmitters, those brain chemicals. So we've got serotonin and GABA and many others. So serotonin being the happy chemical, if you like, in inverted commas, GABA being the calm chemical, in inverted commas. So all those processes, both the mental side, but also the physical side, and the physical side of long COVID, effects on the inflammatory system, etc., 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 are going to cause an imbalance of the normal neurotransmitters, the brain chemicals. Right. The other thing that's happening is, as we know, in long COVID, you have something called gut dysbiosis. So that is, if you like, poorly balanced and dysfunctional microbiota, the friendly bacteria in your large intestine, which are really important for many functions. Remember what they do? They basically are supportive of the immune system. They produce something called short-chain fatty acids, which are really important for energy supply, both for the lining of the gut, but also to stop leaky gut, lining of the gut, but also for general usage of an energy supply, but also the production of synthesis of vitamins K and vitamin B7, but also, wait for it, production of brain chemicals, the neurotransmitters that I've just been talking about. Serotonin, 80% of the body's serotonin comes from the microbiota, from the gut. Dopamine, 50% of the body's dopamine comes from the gut, but also other neurotransmitters, GABA. So if you've got dysfunctional, or you've got microbiota dysbiosis, so your friendly bacteria is not friendly, then that's going to lead to deficiencies of those neurotransmitters. So there was a study done in Scotland where they found that patients with long COVID had low levels of serotonin. That's, remember, the happy chemical. Low levels of serotonin because of gut dysbiosis. And the reason for that is that there's less serotonin synthesized because there was less what we call the amino acid called tryptophan absorbed by the gut, and there was an increased breakdown of serotonin because of a particular enzyme, an MAO enzyme, which broke down serotonin, and then there's less transport of serotonin in the cells in the blood called platelets. That's how serotonin gets around the body, because there are less platelets available because of the hypercoagulable state of long COVID. So this study, long story short, basically this study demonstrated to us, proved to us that your serotonin levels were reduced for 3 specific reasons. The end effect, this culminated in the fact that your serotonin levels are low. If your serotonin levels are low, that equates to depression. So all that has an effect on the gut-brain axis, and it presents, like I said, with mood disturbance and depression, but also anxiety. So, in conclusion, depression in long COVID is due to a combination of both physical impact of COVID illness on the brain, interfering with nerve function, but also the mental impact of the COVID illness on your life, i.e. those personal, those family, financial reasons, the identity problems and sort of self-esteem loss, and fears for the future, the outcomes. So why is it important that to understand the causes for long COVID depression? Because obviously I've spent a lot of time talking about it, haven't I? It's important to understand the causes of long COVID depression because it helps with your validation Helping you understand the causes helps with your validation, and you can tell others that, yes, I have depression because I've got long COVID, and there are reasons behind it. It's not just because it's the effect it's having on my life. There are physical reasons for that depression as well. So, what should you do if you feel that you may have depression? What I've outlined and listed the symptoms. If you identify with those symptoms, you may be thinking, I think I may have depression. Right, what should you do? Well, obviously, what you should do is visit your GP. And that's with any new symptom, anything that's out of the ordinary, anything that's not right in you, you should always visit your GP. You shouldn't suffer in silence. So what will happen when you get to your GP? The GP will hear the story, hear your symptoms, take the history, the whole story and the impact it is having on you. So the GP will be specifically asking for mental symptoms, looking to see whether you are sort of flat and, not interested, in asking whether your emotions are affected and whether you're tearful more than you are normally. The GP will ask for physical effects. Remember, the physical effects that in depression are, your loss of your appetite, your loss of your energy, sleep interference. The GP obviously will also be asking for trying to make sure that not missing red flags. Red flags are those symptoms or signs that suggest anything more serious, okay, that need serious attention and maybe involvement from, hospital specialists. So we must look out for these red flags for depression. So symptoms like, total hopelessness, complete despair, thoughts of self-harm or suicide. Of course, those are cardinal red signs that we must try and we must actually actively ask for to make sure that they're not there. If they are there, obviously, like I said, we need specialist input here. We need mental health service assessment, probably almost certainly a referral to the psychiatric services. We must not overlook these things. We want to prevent harm. We want to be safe. So, if the GP, the family doctor, has suspected and hence diagnosed depression, what's he going to do about it, or she going to do about it? Basically, we need professional help, and there's nothing to be ashamed of. We probably need a combination of mental health service support as well as medication. So mental health service support is basically, evidence-based psychological therapies for helping with depression and probably anxiety as well. Like I said, they often go hand in hand. There are these sort of psychological therapies are given on a one-to-one basis, it's a case of that therapist using their skills in order to be able to help the person, deal with the whole mental health profile. There are a range of options, such as counselling, just simple, straightforward counselling, or there may be deeper psychological treatments there may be psychotherapy, there may be CBT, cognitive behavioural therapy, in which we help to change unhelpful patterns of thinking and behaviour. You might need something called interpersonal therapy, which is focusing on relationships and ability to connect and communicate with others. How else are we going to deal with depression? Well, I've said it already. Probably going to need medication. Again, there's no shame in that. I see, and the way I used to explain it in general practice, I see it as a way of just helping you get out of the rut, out of the pit that you've got yourself into. It's a ladder to get yourself out of the pit. Antidepressant tablets, well, they've been around a long time. Like, they came out in the early 60s. The first one was something called amitriptyline, which none of us use these days. We use it for controlling nerve pain, neuropathic pain, yes, or migraine prevention, yes. But those antidepressants that came out sort of 60-something years ago, we don't really use for depression at all these days, because they do have some side effects, dry mouth, can cause a bit of sedation the next day. They can cause bladder problems. So we have better antidepressants these days. In the late 80s, a group of antidepressants was launched called the SSRIs, so selective serotonin reuptake inhibitors. They came on the scene, and they transformed the management of depression, thankfully. They're more effective, they're cleaner, they're less side effects, they're not addictive. Their role, it's all in the title, isn't it? Selective serotonin reuptake inhibitors, bit of a mouthful. So basically selective, prevent the reuptake of it. So they increase the levels of serotonin. Remember what I said? Serotonin, the gut dysbiosis reduces your levels of serotonin. We've found in patients with long COVID, their serotonin levels are reduced. So it makes sense. Let's top them up. And the first of the SSRIs was Prozac. The first that was used regularly was Prozac, fluoxetine. In a way, it's been slightly put down the list of popular antidepressants, and its place has been taken by a couple that I used most frequently, and that is citalopram and sertraline. Certainly, citalopram is the one I used to prescribe very frequently in general practice. So there are a couple of other groups, but the next commonest are the SNRIs, so serotonin norepinephrine reuptake inhibitors. There's one called venlafaxine, which is the most commonly used for depression. It's also handy because it has a license for panic disorders. So it's pretty good for both anxiety as well as depression. So SNRIs, all of them are taken under the supervision of your GP. Well, they're prescribed by the GP. You can't get them over the counter. You can't get them online. Basically, they're prescribed by the GP, and that's only right, of course, because this is a serious business. They're prescribed for as long as you need them until you get out of the pit. Okay, they're basically discontinued when they can be discontinued when you no longer need them. So, that discontinuation of the tablets are basically supervised by the GP, and it's usually just a slow, gradual reduction to prevent withdrawal effects, and basically a short course of them does help get you back on the road, out of the pit. You may well have heard of other treatments for depression that some patients try. There's a herbal treatment called St. John's wort, which you can get over the counter. It's a herbal treatment. You can get it online, and there's a study that shows that it is effective in mild to moderate depression. But being a herbal remedy, you've got to be careful, because herbal remedies can clash with conventional remedies, such as epilepsy drugs, so anticonvulsants, or the oral contraceptive pill. It can interfere with the uptake of them and the levels in the circulation. So if it interferes with the levels, therefore those medications are less effective. So, basically we can't stop patients choosing to use St. John's wort, and we only hope that, the patients choose wisely, and check the small print and run it past their GP if they're not sure, and stop them if they're not helping or causing any side effects. So, are there any other ways that we can help with depression in long COVID or depression in general? Well, yes. Self-help ways. So there's journaling. So what's journaling? Basically, journaling is all about writing it down. Sort of writing your thoughts down on a blank piece of paper. Getting it out of your head and onto a piece of paper. So, that's quite a sort of therapeutic process in its own right, what we call cathartic process. So, like I said, out in front of you. And it helps you see things better, see things, in perspective, in proportion. Then there's mindfulness. Again, that's really helpful, and you can use it alongside those talking therapies and those, the counselling, etc., and also the medication. Mindfulness is a tried and tested and backed up by lots of studies to prove that it actually has a benefit above the placebo. It's not all woo-woo. It's a respectable treatment that helps with focus and calm and focusing on seeing the now and focusing on now rather than looking back. If you look back, you have regrets and you get depressed. Affects your mood. If you start always looking forward and worrying about the future, you get anxious and sort of anxiety. So no, mindfulness is all about focusing on the now. And studies, like I said, show that mindfulness works. It's a brain scan of people who do mindfulness regularly compared with those who don't. So this study I'm thinking of show a difference in the brain, in particularly what we call the limbic center, the emotional center in the brain. So consider mindfulness. So what can we expect from, dealing with long COVID depression and, the whole depressive process? What can we expect? Well, let's think about it just logically. First of all, you've gone and asked for help, which is fantastic. We're getting a diagnosis, which is good. Like I said, don't suffer in silence. And you're probably going to need medication, yes, to correct that chemical imbalance in the brain. Well, it sounds logical to me. You're probably going to need help from mental health services, from talking therapies, to support those mental readjustments. And both working together, with time, can be withdrawn when things are back on an even keel, when depression has settled when you're, no longer have those mental symptoms of being dull and sort of flat and sort of not interested, and those the physical symptoms that can go with it. So, that's what we can expect, and that's what you're going to need, a combination of medication plus also those therapies. But also you're going to need time, aren't you? You need time for those underlying long COVID processes to settle. The inflammation, it calms with time. Those damaged nerves sort of regrow and reconnect. The microbiota can be restored with time. Those mini blood clots that are here, there and everywhere through the body, but in the brain also, will be dissolved sooner or later. The circulation will return in those parts that have been blocked off. Mast cell activation and dysautonomia will settle with time. How can we speed that up? That sort of natural healing process for long COVID recovery. How can we, that's what we'd like to do, isn't it? Well, we've got to think of the bigger picture, don't we? So we've got to be focusing on sort of, lifestyle factors such as, your diet, a mixed balanced diet, and that will help the restoration of your microbiota, those friendly bacteria. Sleep, we've got to work on sleep hygiene, really important for restorative, reparative sleep. Focus on, de-stressing, so I've talked about mindfulness and focus. Think about physical reconditioning. So gentle reconditioning with a gentle stretching, maybe yoga would be helpful. Certainly it will be. Energy management. We've talked about, how to tackle fatigue and using the 3 Ps. So planning, prioritizing and pacing. So all really important to aid the recovery from your long COVID. And consequently, if you can do that, as well as use those other sort of ways to tackle long COVID depression, namely the medication as well as the talking therapies and mental health services, the combination of all that will help address your long COVID depression. So there it is. I hope you found that helpful. As I said at the start, this is an educational series for all of those of you who are still suffering from long COVID. Everything I've mentioned, remember my disclaimer, anything I've mentioned, all the advice and the treatments I've mentioned, please discuss with your doctor first. Remember, ask for help if you feel that you do have any of those symptoms that are suggestive of long COVID depression. There's no shame in asking for help. So there we go. If that's been helpful, obviously, share that with anyone else you might know who has long COVID. Click subscribe if you're looking at this on the YouTube. I want to get these messages out there. So, and the other thing is obviously, that feedback, I'm really grateful that you've taken the time to comment and make suggestions, etc. I apologize that I can't answer your queries. People ask me lots of, my advice, but I'm so sorry. I haven't got the time to do that because of my involvement with the Long Covid services I work with. So there we go. So in the meantime, I wish you well, and I wish you well with your long COVID recovery. So all the very best. Cheerio now. Bye-bye.